Hello, Suzanne with Dunning Vision's Hypnosis. Here to ask you a serious question. Do you ever find your mind wandering when you're in session with your patients? This can be a really big problem. And it comes up quite often, actually, when I'm answering questions on CORE from people who are wondering what their therapists are doing because their therapists are not answering their questions in any reasonable fashion. Sometimes their therapists are checking their watches or the clocks on the wall, or in other ways demonstrating that they're not really very happy to be in that session. It all does come across, folks, and it's not a really good situation for either you or the patient if this is something that's happening to you. So what do you do? Well, the first thing that you really need to do is figure out why it is that you're not wanting to really be in that session. Is it the patient? Is it that you're just bored of the work? Or is it that you're overwhelmed with the work? Maybe you're working too many hours, seeing too many patients. You need to figure out what's going on with you so you can correct it. Sadly, the average therapist only lasts in the job between 2 and 7 years. It's not a really long time. And it has a lot to do with the fact that it's really hard work. Listening to people's stories of trauma, stories of heartache. And even when they're not telling a whole lot of stories, but they're just sitting there basically complaining about everything to do with their life and they're not willing to do what they need to do to rectify anything, it becomes a challenge in how to go about helping them in any significant way. So maybe that's when a therapist would naturally check out. I would suggest that you sit down with a pen and a journal and write up what's going on with you and figure out what it is that the core problem is. Because when you figure out what the core problem is, you can rectify it. It may be that you just need to switch the type of clients, patients that you're working with. It could be that you don't like working in the agency that you're working at because they're demanding too many hours of you. Because the therapists are the people who bill, and so that is the economy of the place for everybody else who gets employed there. And that could put a lot of pressure on the therapist to produce. I've heard horror stories of this happening in some places, especially the community centers. Or it may be that you don't enjoy working with some of the types of clients that you have. I know for myself, I used to work with drug addicts and I stopped doing it because I don't enjoy working with them. I had one that worked out really, really well, and the rest of them, it was just thankless work, to tell you the honest truth, sadly. So you need to figure out who you like working with, what types of problems you feel you're gifted at helping your patients work through, and niche down to that. And if you're working for yourself, it makes it a lot easier for doing your marketing because you can market to that particular person and they'll know that you're their therapist. What could be better? And if you do a really good job with them, they might send you referrals. I know I've had several people send me referrals for the work that I've done with them. And that's always a really, really good thing. And generally, their friends had similar problems to what they had, all right? That's usually the way it works. So give those ideas some thought so that you can do your job in a way that works best for you. Because you can only do your best work with your patients if you're feeling good about the work that you're doing, right? If you want to go out on your own, it's not the easiest thing in the world to do, but it can be done. And it will be even more important for you to niche down to specifically the type of patient you want to work with, again, for marketing purposes. If you want to learn how to integrate hypnotism and neuro-linguistic programming into your practice, I offer a 2-day VIP program. You can do it in a Saturday and a Sunday. And it includes 12 months of mentorship, so that as you're working with your patients, you can actually just message me and tell me that you're having a certain problem that you need help with your particular patient. We set up a time to have a video call. I tell you exactly what to do. You do it. And a few days later, you're going to call and tell me how great it worked out, or maybe message me. I get a lot of those from my trainees, and that feels really fulfilling because my goal here is to get as many mental health therapists trained in hypnotism and neuro-linguistic programming as possible so that you can help way more people. And by the way, when you actually have a real solution where symptoms aren't being managed and people can actually overcome their problems that they came into you to resolve in the first place, you can charge a hell of a lot more money. You can sell programs in the thousands, multi-thousands. I'll leave my contact information in the description box below. So if you're interested in finding out more about that, we can set up a video call and see if that's something that will work out for you. That's all I got for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye all.